So this is the study led by one of my trainees, Dr. Yucai Wang from NYU internal medicine program. So the question we had actually was twofold. One is, there's this interesting observation that in mantle cell lymphoma incidence, you always see about a 3-to-1 ratio, male to female ratio at the time of diagnosis. We don't know whether women are less prone to get this type of lymphoma, but the question is, if they do get lymphoma, the mantle cell lymphoma, I mean, do men and women do differently in terms of survival, given the difference we see in terms of incidence? The other question we had is, there's a strong interest in studying minority patients in clinical trials, because we know there's a challenge there. Usually these populations are less well represented in clinical trials. So it begs the question, how do these people do in a standard of care setting? And do we need to push our efforts to get more patients in these trials, or do they benefit, or do they need more newer therapies? So that's why we use the NCB database to look at outcomes by sex, race, and ethnicity, using this very large database over 30,000 patients. So the first question, in terms of male to female difference, interestingly, we saw that the female patients actually did a little better in terms of overall survival, even after adjusting for other disease or patient characteristic factors that we can have access to in the NCDB database. So it's interesting that not only are women less likely to develop mantle cell lymphoma, and it looks like they do a little better in terms of survival when they do get this lymphoma. Secondly, also interestingly, in terms of race and ethnicity, we saw that the Black patients in terms of race and the Hispanic patients in terms of ethnicity, when we look at the outcomes, interestingly, actually, encouragingly, we don't see a signal that these patients are doing worse than the white patients in terms of race, or the non-Hispanic patients in terms of ethnicity. So I think these are interesting, very important data that at least these minority patients do as well. As good as the counterparts. So, which is good to know. But I think we still need to include all these patients in the clinical trials moving forward. Okay.